Many of you have spent your years in either healthcare delivery or healthcare management, managing the 15% of the population that consumes 85% of the resources we spend on healthcare. I know I did that for many years, and I'm sure most of you have. But what we've done collectively is not in the best interest of the populations we care for. We've basically ignored those 85% of the patients that don't go to the emergency department frequently, that don't get readmitted to the hospital, that don't keep going back to the physician's office time after time after time and crying out for help. We have wrongly assumed that this 85% are the healthy ones. The reality are, I call them the invisibles. What I mean by that, these are patients that are actually ticking time bombs, that have health attitudes, health behaviors, relationships with the healthcare delivery system that put them at high risk for the development of acute or chronic disease, and we're ignoring them. At CentraForce Health, we have a specific rising risk solution for health systems, hospitals, and ACOs. What this basically allows you to do is to take your population, mostly those that are attributed lives, and look across the spectrum at those which have not had a series of emergency department visits, of hospitalizations, don't have a chronic disease diagnosis. It allows you to look at those seemingly healthy individuals and stratify them so that you know those that are at highest risk for a health disaster, a catastrophe, the onset of a chronic disease like type 2 diabetes, and then provides you the insights to allow you to intervene proactively, prospectively, to change the course of their life and potentially prevent a chronic disease or an acute catastrophe.